It's my pleasure to be the moderator for this first session this morning on Friday. My name is Carla Cardosa, and it's a pleasure to be here, and I'll be supporting Teresa in her presentation. She's going to be talking to us about a holistic approach to treating perinatal mood disorders and birth trauma from the yoga therapy, lens, limbic system, and vagus nerve regulation, somatics, mindfulness, and self-compassion. And I think that's why everyone is here today, so thank you everyone. It's a pleasure for me to present Teresa Wilson, and take it away.
Thank you so much. Can everyone hear me on this mic as well? No? All right, now, can everyone hear me now? No? A little closer. All right, it's going to be right up in here. Okay, now it's good? Perfect. No? I just have to talk louder. Okay, I will use my deep voice. Okay, perfect. All right, so welcome everyone. Thank you so much for coming to this presentation. So I really wanted to just touch base and talk about, we're going to be implementing some of the clinical skills you can use with clients, but also bringing the science aspects in, at the same time. I think they just turned it up for me, so perfect. So we're gonna start with a guided experience. So if we all want to get, you can hear me?
No, we can hear you, but the room behind you is very loud.
Oh, okay.
They're louder than you are.
There is some room in the front to sit if anyone wants to come and sit on the floor, and maybe here as well. That should be okay as well. But if we're going to get started, we can get started with a guided experience. So if everyone wants to just get comfortable and settled in, and we can even start with closing our eyes if that feels comfortable to us or accessible, or just softening our gaze. So we're going to start today with a gentle body scan. So we're just going to kind of settle into our seat and ground with our feet on the floor, closing our eyes or softening our gaze. And we're going to connect with the energy around us and just focus on finding a safe space in our body. So feeling rooted, nourished energy and safety, beginning to root through our feet, grounded with the floor, feeling that energy as it extends up, maybe into our ankles, our legs, and taking some deep breaths while we're here, just enjoying the space of feeling grounded and rooted. Feeling that nourished energy as it travels through our legs, perhaps moving our feet around on the floor a little bit just to really have full contact. Settling into the stillness here. We're grounding through the base of our spine, our hips, our seat, our pelvic floor, feeling safe and supported where we're at. Maybe we envision some visualization. We envision that we're sitting in a place that feels familiar and safe to us today. If it feels comfortable, placing a hand on our belly and one on our heart, and coming into our breath awareness. Let's begin to notice where your breath falls naturally today. Is it shallow or deep? Is it maybe focused in your belly or your chest? Think about what triggers you to breathe in different ways. How does your posture relate today to your breath or how you feel? Begin to invite a deeper belly breath to expand into that hand on your belly, lifting your chest through the crown of your head, and an exhale, releasing any tension that you're carrying. If you feel comfortable, take a few moments here settling into a pace of breath that feels safe and secure for you. Noticing how it may be changed or shifted from the last few minutes of sitting down today. We can place our hands on our lap when we're ready, and we're going to do a gentle series of chest and back opening and closing. So on our inhale, we're going to roll our shoulders back and open up our heart space forward. And as we exhale, round our shoulders, press our spine into the chair behind us. Inhale, opening our heart center, expanding through our ribs. And exhale, rounding our spine, releasing any tension in our shoulders, our neck. Take a few breaths here, and we'll go at our own pace, so as fast or as slow as it feels safe for you. Notice as we awaken that energy in our spine, in our belly, in our chest, where we feel stuck points, where we want to come back and check in later. Just noticing the breath as it relates to our sensation. When we're ready, coming to a neutral spine, we're going to gently roll our shoulders and find some gentle movement within our neck and our throats. If it feels good, we can push our head side to side or turn our head in different directions. You can even move your mouth, taking a gentle yawn. Notice if you feel any urges to yawn or sigh at any point during these breath exercises. It signals a shift into parasympathetic nervous system. Finding a place of stillness when we're ready. Maybe giving ourselves a gentle hug, one hand on each opposite shoulder. And we can give some squeezes here, so incorporating some bilateral stimulation with our breath. Comfort, nurturance, you are safe, you are held, you are seen. One more big deep breath and we can come into a comfortable position here. On our exhale, noticing anything we've released today, any stress or tension that you were carrying, and knowing we don't have to carry that anymore right now. Maybe notice if any messages came up. And practice a moment of self-compassion, knowing that we can see these thoughts and emotions and they can come through us with that breath, but we don't have to hold on to the same story. We can come in, practice these experiences, and then leave feeling differently than how we walked in the door. So that is the essence of incorporating some somatics and yoga into our practices. Sometimes the talk work feels kind of heavy, and being able to ground in our bodies is a great way to start things. So I'm going to start the slides. I think I have to click on something. There we go. All right, so my name is Teresa. I am a licensed mental health counselor. I'm also a 500-hour yoga teacher, and I am very close to finishing up my yoga therapy certification, which is 1,000 hours of yoga therapy training to integrate that with mental health. Thank you. Thanks. So a lot of what I'm sharing today comes from the blending of those two worlds, but I'm trying to put skills into practice that any profession can use. Doulas, midwives, doctors, nurses, therapists. There is some lines that we'll talk about later about where some of that intersection can come in and where we refer out, but for the most part, these are accessible clinical practices as well for both modalities. So having worked with PMADs, perimental, mood and mental health disorders in my own clinical practice, this is something that's really close to my heart. I have a huge population of these clients, and I have personally found that these disorders are not just psychological. They are very deeply embodied, and they often arise from this dysregulated nervous system and unprocessed trauma that occurs within pregnancy and the postpartum and birth period. So there's this internal sense of threat or disconnection that we often find with these clients. So as we know, I like to keep the statistics brief because most of us here know the basic statistics, but at least 1 in 5 postpartum clients are experiencing these issues, and they often arise from the birth process, sometimes even NICU stays, lack of sleep, medical gaslighting, feeling unseen or supported during what we go through becoming parents. And as clinicians, I think a lot of us have found that we have to expand past the traditional top-down approach that we've constantly seen in talk therapy, where it kind of falls short with these clients. So cognitive therapy and medication, I definitely think can be essential, but if we fail to address the nervous system, we're not going to see that true integration or resilience that is possible for healing these issues that come up. I truly believe that all clients can benefit from these bottom-up approaches, but especially with neurodivergent and marginalized or trauma survivor clients, we see the bottom-up tools being really helpful. In fact, there's been some studies talking about how talk therapy alone can be insufficient for lasting healing. The body can hold these stories that our mind is not always articulating. I wanted to also just acknowledge that often with the bottom-up approach, it can be more inclusive for vulnerable populations. A lot of times traditional talk therapy is not always rooted in an inclusive space, or a lot of the research that has done is outdated. And so wanting to just focus on how we can support our more vulnerable populations using this modality. Sorry, I'm not really good at keeping up with my slides, but that's okay. I'll be like, and let's catch up. So we did this practice in the beginning, and I did put this in the handouts because a lot of these things are things that we'll be able to integrate as we move through with our own clients. So I wanted to start and talk about kind of this failure of the cognitive medicalized approach. So Bessel van der Kolk argues in The Body Keeps the Score that talking about trauma is not often enough, and sometimes talking about it actually activates the fight or flight mode if the nervous system is not regulated first. So he writes that trauma is not the story of something that happened back then, but the current imprint of the pain, the horror, and the fear that still lives inside of us today. So many clients, especially with complex trauma, often dissociate or struggle to heal through that talk-only approach. Research in somatic psychology with Ogden and Fisher shows that trauma is held in the body, and the purely verbal interventions often bypass the limbic system getting stuck in fight or flight mode. So someone trapped in that mode might need to start with a body-based approach, and the most amazing therapist in the world doing a talk-based approach is not really going to get through to them if their body is not in the right state. So trauma is not just a memory, it becomes an embodied nervous system state. When the nervous system is dysregulated, the limbic system dominates, so it takes over that visceral feeling of being in fight or flight mode. A client might come in and seem agitated or defensive. They might be overwhelmed or stuck in a shutdown mode where they're crying, and you can't really get them to engage in these interventions that we traditionally would. In the freeze states, which are very common with PMADs and birth trauma, clients might dissociate, they might go blank or feel numb, and they are not able to access their higher order thinking to process things cognitively. So I had a client who, I like to give case examples as I go through so it feels more relevant. A client coming in with severe birth trauma, she really struggled to describe her panic in a cognitive sense, but her body felt like it was clenched. Her heart always felt like it was racing, and her jaw was hurting so much that she had gone to multiple medical specialists, always thinking she was having a heart attack. And as we processed her trauma, we found that these were very much somatic clues of being stuck in a frozen or fight or flight state, not quite a medical issue as the providers were assuming that it was. So how I like to start with these clients is offering body tracking sensations. So you can ask them to notice subtle shifts. So as they're sitting there and you begin to discuss a different topic, rather than jumping into an overcognitive explanation, ask them what happens in your body as you talk about maybe being in the NICU with your baby. How do you feel that differently from when you first sat down and did that breath exercise today? And that's where when you start with a grounded experience like a breath work, you're putting them into that relaxed state to begin with. As you begin to ask how something changes when they talk about their experience, they have a baseline to go off of. I think it's important to remember to ground clients always when they first come in, because often they're walking around stuck in fight or flight activation. They don't even realize the state that they're in. So if we ground them at the beginning of a session, they're going to notice more of that shift as they talk about things, that there is a connection there to their body. Then we move on to something like orientation and grounding. So we want to have them orient their eyes around the room, name things that they can see, shift their weight in the chair to begin to feel that they are in their body if they seem that they're dissociating or that they're re-triggering a traumatic memory. Feeling their feet on the floor. These all are going to activate that ventral vagal system and help them to feel like they're coming into safety. And all of these practices are going to help exit that fight or flight mode that we talked about. Sensory motor work uses this incomplete survival response, like that urge to push something away or escape, that we often don't get to complete the cycle when we're in the trauma. So for example, a mom who felt powerless during labor, we might explore more intensive movements like pushing against a wall or feeling like they're able to really bring back a sense of agency within their own body. And that's something that we really can only explore and complete that loop through movement. They might be able to practice then associating, advocating for themselves or using assertive language, but being able to pair that with a strong felt sense in their body of pushing away or getting up and walking across the room while retelling that story. We need to give people permission to move their bodies while they're healing. I think people are like, I have to sit in this chair and just process things. And if we're like, hey, let's all get up together and let's push this wall. Let's walk away from that doctor's office where you felt like I should have said something differently and I didn't. We're allowing them to reinvent how it felt in their body so they can complete that trauma loop and move forward in a different way. Also this idea of dual awareness, helping them stay grounded in the present while also trying to work through the past traumas. When we bring in the breath work, when we bring in the somatics work, we're giving them a tool to come right back to this moment rather than feel like they have to get pulled into a different state from the past. So especially with postpartum clients, an overwhelmed client thinking about their birth trauma, helping them to use these is going to give them a sense of being safe right there in that moment. Okay, still have to talk about the limbic system. There was a research study done by Lilienfeld in 2007 that did a study with critical incident stress debriefing, which is a very talk-heavy intervention after trauma, and they did find that it can actually worsen PTSD symptoms. The reason I bring that up is in that study, they didn't really integrate any somatics or body awareness, and we theorized that being able to talk about the trauma actually does help, but you have to start with integrating the body first. I think some people misinterpreted that study that we shouldn't debrief at all. I do think that debriefing things like birth trauma is super helpful, but we have to feel safe in our body before we can move forward with that. Has anyone, just kind of show of hands, has anyone integrated somatic work in their own healing or tried to use it with their clients? Okay, awesome. I figured people coming in would also have a general awareness, but some people have never used it or really felt into it, and so it's good to be able to bring the work on a wider lens. How many people have found other medical providers or doctors that have no idea how to integrate somatics and feel like it's something that needs addressed? Right, so I really like to look at Dr. Gabor Mate's work and how he, is kind of bridging that gap between Western medicine and psychiatry and then the mental health world. So he really talks a lot about not pathologizing seeking care and that trauma is a natural response rather than something we have to label in a medically misaligned way. And then body literacy. So this is where we start talking about educating clients on the limbic system and the vagal nerve. So if we give them this psychoeducation and compassion, and we really can always bring them back to a normal nervous system response and understanding their nervous system, we're no longer always telling them, well, this is your trauma, this is a symptom, this is depression, this is anxiety. Those can be helpful in certain aspects. But my favorite way of integrating holistic work is that you're having a very normal reaction to very traumatic experiences. And it would be more odd if you didn't react in some way to these things that are happening. So I like to say that when we're treating PMADs, education is powerful, but it has to be felt, understood, and embodied first. And a lot of these clients have never had exposure to understanding nervous system literacy. So there are some great tools, and I believe I included them in the handouts that are online, but Deb Dana created this polyvagal ladder. And so there's these printouts you can get, and I have them in my office to continually remind clients, check in with what state you're in. A lot of clients are always focused on the emotions that they're feeling or the trauma they've gone through, but they have never really been taught that their nervous system has these states they can identify, and they can shift in or out of them with very simple tools. So this is why I like to teach them about these things as we go along. The ventral vagal, which would be the top of the ladder, is when you're feeling totally safe and connected and engaged. The sympathetic or middle zone is that fight or flight, anxiety, rage, a sense of urgency. And then dorsal vagal, the bottom, would be like freeze, collapse, numbness, or shut down. It's a little bit of an oversimplified way of viewing it, but to help with the client's understanding it, that ladder is very helpful. What we like to talk about isn't necessarily that one state is better than the other, because even fight or flight mode serves a purpose. So somatically, if a client is like, well, I can't get myself out of this state, they might not be in a safe place to always be out of that state. If they're returning home to an unsafe environment, or if they're returning home and they have to stay up all night alone with the screaming baby, that fight or flight mode and that adrenaline might be kicking in to actually be protective for them. But we can talk about how just for this hour in therapy, how could we shift ourselves just one rung up that ladder and try to regulate ourselves more? What would that feel like? How does each state feel in my body? We're also then normalizing and not pathologizing that fight or flight mode is something to fear. So if they feel that activating, they don't have to be terrified of, oh, when that rage bubbles up, I don't know what to do, and it's something's wrong with me, and we have to label it. It's, okay, well, you're stuck in this rung of the ladder. Let's do our breath work. Let's do our body awareness. How do we shift ourselves just for this moment, just for this hour, into a state where we feel calm? Then we give them the tools where they can bring that home and say, what about for 20 minutes right after the baby goes down for a nap? We can replicate these tools again. They've become to have this sense of agency over their body and their nervous system state, rather than feeling like it's this roller coaster that they can't control. And holistically, I think that's what we want to do, right, is give the clients back a sense of agency that they own their experience. They don't come to the doctor or the therapist to fix them, and then they go off and they're adrift and they have no control over the situation. And this is also something where we talk about different tools. Deb Dina has an amazing book on polyvagal principles. She talks a lot about using ideas of glimmers, building moments of hope into the day. So having clients recognize, you know, it couldn't have probably been that every single hour of every single day of every week since the last time I saw you, you felt that level of rage or that level of fear. Was there at least one moment that you noticed something, even if it was your baby smiling or looking out your window or when you took that nap, that your nervous system felt regulated? And if that has not been the case, helping them to come up with lists of things that they can look for to find that peace within themselves again. There's also a lot in the yoga world where we talk about these different qualities of finding that from that perspective of more of a holistic framework. And so that idea of helping the clients to understand with our own role as a therapist or as a clinician in any role, we're helping them to co-regulate. So the tone of voice that we use, the breath that we show up with them in that room. How many of us are therapists in the room right now? Okay. How many are medical providers, like doctors, nurses, doulas? Okay. So even just for that example, I think most therapists are thinking about approaching the room with a different energy. But sometimes in a hospital setting, I worked in the ER in Psych for 6 years, and the number of times doctors or nurses run in, and they're just like, oh, and it's this emergency, and they're so high energy. And that can be really dysregulating for the client, right? So if a client's going through birth trauma, say they're going through a hemorrhage, for example, the medical providers are kind of the front line of what determines their experience. And if they have providers that are normalizing it and saying, we're going to take care of you, and they can control their anxiety, even in a medical emergency, a lot of times that can dictate how the client stores that trauma versus a doctor coming in and yelling at them and forcing interventions and not explaining things, right? So it applies kind of across the board. When it comes into understanding, you know, a little bit more of how this all relates back to our own way of viewing it within the yoga framework, and I know yoga isn't, you know, necessarily everyone's framework in the medical field, but yoga has their own way of relating to this, and a lot of clients are finding that, again, taking a model that is not medicalized is helpful. So I use the example in yoga therapy, we have these maps of how we view the body. So for example, there's these qualities. Rajas might be a sympathetic energy, like activation or kind of a restlessness. Tamas is like a heavy inertia kind of state, or sattva state, which is this clarity or calm, kind of like the ventral state. I have some clients that everything that they talk about with me, it's like their zodiac sign, right? It's like, well, my Gemini husband said this, and my Sagittarius daughter said this. But I really love that, even though it's not all evidence-based. Anything that can help someone make sense of their experience that doesn't have to feel like it's pathologized, I think is really important, because there's a lot of talk where clients feel a sense of shame and stigma, especially with perinatal mood and anxiety disorders, and explaining to someone that they might just feel a sense of this rajasic energy, or this sense of, I don't quite know where my role has fit in here now that I'm a mom, and it feels chaotic, feels a lot better than always just like, oh, you're dealing with postpartum rage and you can't control it and it's something to pathologize. Same with the nervous system framework. So that's something where we're trying to bring in understanding that we can find intersectionality between yoga and some of these things, but I really like to note, it's not always in that woo-woo sense. They're like really doing well, so I hope that I'm, that I'll have a good moment like that. See, we're doing better over here. Thank you. That really helped boost my rajasic energy today. But again, I had a therapist that works for me that recently went to a training, and it was like very woo-woo. I'm not going to name the training because some of you might have done it and you might have loved it. But she came back and she's like, I think I just joined a cult. Like, she was very... She was like, I don't know what that was, but it wasn't evidence-based and it was kind of scary, and we're a holistic practice, so we're used to integrating science and holistic therapies, and I'm just aware that sometimes we get a bad rap because there's other modalities that don't bring in the science. They're very, woo-woo is the term that is most often used, and that's okay. I love some woo-woo. I have some crystals, but in the therapy space, I think it can make a client feel like, oh, is there any evidence to what you're doing? And it can get to the point where it feels like, oh, yeah, that therapist just told me to envision myself as a tree and like breathe a bunch, and I'm having a real issue here. So we need to root them a little bit with both. And same with bringing nature into play. I think that helping clients feel grounded and regulated, they'll often say that being outside is one of those things. How do we integrate things like nature therapy, but from a science perspective? How do we explain to them how nature helps our heart rate to be balanced? How do we explain that our circadian rhythms are often really thrown off in the postnatal period, and just being outside in that sunlight might help our sleep cycles? It doesn't have to be like, yes, go sit, be one with the tree, although I think that has a place too, but it's going to help them to see different ways to support themselves, but that there's science behind the things that might already be feeling good to them. And often moms have a huge sense of guilt, or parents in general have a sense of guilt. Well, I really feel good after that walk, but then I left my partner alone with the baby, or I didn't get the house clean. Well, if there's a scientific reason you feel good after going outside or doing a breathwork practice, you're more likely to keep up with it too. It doesn't feel like a selfish thing that just feels good. There's science behind how it's helping to heal you too. So when we're applying this to birth trauma or things like that, it's the same focus. It's finding gentle movement, bringing back a sense of agency in the body, and trying to work with this idea of just meeting clients where they're at. We're finding that with yoga therapy, we know from multiple research studies, especially Streeter did a really monumental study, that yoga is reducing cortisol, improving heart rate variability, and vagal tone. So we're trying to get this connection with interoception and reconnecting with the body, and restorative poses, like everything that we're doing from a clinical perspective. We're sitting in a chair or we're doing a gentle movement. We're not teaching a yoga class, and I think some therapists or medical providers feel kind of afraid, like, well, I don't have this yoga certification. We're not doing anything groundbreaking. We're not doing a vinyasa class. We're not standing on our heads. We're just helping to reconnect with our body. And yoga is one of the most well-researched somatic exercises that we have. So when I say yoga, it can be any sort of embodiment practice, but we have a lot of research on yoga in particular. So I wanted to clarify that, because everyone's like, well, does it have to be yoga? There's great other practices we can use as well. So when we sit, for example, with our feet on the floor, and we just do 3 exhales that are longer than our inhale. That is the trick. We're shifting into a different nervous system state. So Dr. Levine has, figured out that really makes a huge difference. Just 3 deep breaths where we focus on extending our inhale longer, or our exhale longer than our inhale. If you think about the opposite of that, it's hyperventilation, right? We're taking these huge, short inhale breaths, and it feels like you can see someone breathing like that and you tense up. So as soon as we signal, oh, that exhale feels long, we add a sigh into it, you can't breathe like that if you're not in a calm state. So it's kind of like hacking our body to trick our mind into feeling safer. Even if we're in the middle of a crisis, if we can transition the breath to a longer exhale, our mind is like, well, wait, we're not hyperventilating, I must be safe enough. And it can open up that doorway to have deeper clinical conversations. The same thing with hand to heart and belly that we did in our opening practice. It's making us aware of our vagus nerve, and so we're understanding that there's this connection between our head, between our throat, between where our nerves lead in our body. And then when we visualize that safe place, it activates the parasympathetic nervous system. We can be in any situation that feels stressful, but we're shifting ourselves back to a sense of safety. So we've already touched on that because I go off on some tangents sometimes when we're going through things. So mindfulness, self-compassion, I would be remiss if I didn't talk about the connection between just mindfulness here. So we're not just talking about how to physically move the body in these practices. We want to talk about the mindfulness pieces. So when we're talking about mindfulness, we're returning ourselves to the present moment with gentle awareness. And that's really all it has to be. I have clients that love the spiritual aspect, and I have clients that get kind of nervous or worried about yoga or mindfulness. Is this meditation? Is this bringing in some different spirituality I'm not comfortable with? Mindfulness is just about being in the present moment. I don't know if anyone's had that experience or if it's just me, where I've had some clients, and I love all of my clients and I respect all of their beliefs, but I'll try to integrate a breath work and they're like, oh, that's yoga and that's from the devil. And I'm like, okay, well, we could, it's okay to feel that way, but we're also just breathing or we're just moving our bodies. So how could we do that in a way that feels safe to you? And so sometimes mindfulness feels less scary to them than a big movement-based practice that might feel a little bit foreign. So with mindfulness, we're bringing that awareness to the present moment, and we're doing that with curiosity rather than judgment. So there are some people who hate the idea of mindfulness because they're like, no, I'm trapped in my head too much, that's the problem. So we want to focus on this idea that with mindfulness, we're focusing on the state that we're creating in our body. So oftentimes if you do the breath work, if you get them to focus on a visualization that makes them feel safe, then we settle into a mindfulness practice, they're going to see that there's some part of their brain and of their present awareness that feels safe. Research by Marchand has shown that mindfulness-based interventions significantly reduce perinatal stress and improve emotional regulation. Mindfulness mixed with self-compassion, I have found, are the 2 most powerful tools to blend together when we're working on the limbic system overactivation that we see with PMADs. So we're talking about chronic stress and trauma and these demands of new parenthood where we're locked into fight or flight mode, but we're also talking about all of the judgments and all of the shame and all of the guilt and all of the arguments with, other people in our lives that sometimes come up. So we like to involve this self-compassion side. Is anyone familiar with Kristen Neff's mindful self-compassion work? Awesome. So that ties in really well with this kind of work. We're trying to focus on using meditation and mindfulness and helping parents navigate perfectionism or burnout by normalizing that every parent goes through these experiences. A lot of these clients feel like they've lost themselves, especially with pregnancy, with postpartum, with these symptoms that feel completely out of their control. We want to give them permission to be human and to kind of come back into their awareness of themselves. And we can also integrate things like mindfulness-based stress reduction here. because in scientific studies, they have found that that's leading to improved emotion regulation, decreased anxiety and depressive symptoms, and enhanced vagal tone. So we want to be bringing back in the science behind why the mindfulness is working for them. When we think about incorporating this with self-compassion, we want to focus with the clients first on the mindfulness, recognizing the moment they're in. What is the emotional state? Then we want to bring in a theme of like common humanity. So how do we understand that that suffering is part of the shared human experience and that it's normal, it's not something to pathologize? And then we want to offer some self-kindness. How do we bring in warmth or care towards yourself in that moment of pain? Often these clients are feeling isolated, they're feeling stigmatized, they're comparing themselves to other parents that are going through these issues. So bringing in self-compassion, I think, is really key. You might get a couple moments of calm with a somatic practice or a cognitive approach, but then they're still judging themselves when they leave. Well, why did I need therapy to get that moment? Because, Sandy over there had her kid and she's fine, and why do I need the therapy part? Normalizing that everyone is going through these things at their own rate and in their own experience, and that they can talk to themselves in that way. So a quote that I like to use that I kind of took from some of Kristen Neff's work is saying to yourself, this is a moment of suffering. Suffering is part of being human, and may I be kind to myself. Normalizing that experience once again. When we think about including, I think, cultural differences and being inclusive with therapy, I think we all are aware of just the disparities with traditional therapy in this lens. So I wanted to talk a little bit about, obviously, like I said, yoga has some of the most evidence-based focus here, but we do have different clients that come in from different backgrounds. And for example, with a practice on yoga chanting, for example, we use this one chant, and it's the Kirtan Kriya, and it's been studied a lot. And we can all try it together if we feel comfortable chanting, or we can do it silently in our heads because everyone else will drown out if we're not saying it. So it's Sa-ta-na-ma. And what we do is we can also integrate our fingers, so Sa-ta-na-ma. And it goes to the first couple notes of Mary Had a Little Lamb, is how I remember. I'm not the best singer, but we'll all try it. So it's Sa-ta-na-ma, Sa-ta-na-ma, Sa-ta-na-ma. And we can go on, and as long as we want to with that, we can go on forever. In the research they've done, I believe they go on for 7 full minutes. And it's like 2 minutes loud, 2 minutes a little quieter, a minute silently, and then it goes back up. There's an actual science to how they do it in yoga therapy. But for some people, all it really talks about is it talks about death and a cycle of rebirth. That's the deeper meaning behind the phrase. There are some people that might not feel like that resonates with their culture. They might feel that that's a little off for them. So some ideas that I found have been, for Christians, they can pick a Bible verse and just repeat the same maybe 4 words to themselves. But they can still pair it with that physical touch, and maybe pair it with a song or a hymn that they're familiar with. And it doesn't maybe feel as odd to them as doing something that's outside of their culture. Within Buddhist practices, metta meditation, may I be safe, may I be well, may others around me be well. We could pair different sayings with it. I don't want to say the pronunciation wrong, but within Islamic and Jewish practices, there are very specific intentional prayers that can be repeated that could replace that depending on your client's preference. Just ask the client, honestly. I'm not going to come up with it and tell them what they should do within their own culture, but just helping them to understand that it doesn't always have to be from the yoga perspective. We can take the science that we know works from this perspective and add in their own culture there. I think the reason that spiritual tools really matter when we talk about this is not just that it normalizes the experience, but it helps the clients to really realize that they already carry a lot of their healing within them and that other people around them may be able to help. So spiritual communities, while not always helpful in mental health, sometimes can be really helpful in this sense. And it allows clients to take something familiar maybe from childhood, such as a prayer or a mantra, and use it as part of their healing. I also just think that when we bring in this idea that breath work and chant work and moving and ritual is healing, it really reminds us that there is such a simple return to the fact that indigenous cultures have been able to practice and heal from a lot of these, diagnoses and disorders for many years before Western medicine came around. So we want to be able to think about how colonized clinical models very often have silenced embodied and communal healing, and that was actually a huge part of the rise of Western medicine and the pharmaceutical industry is oh no, that doesn't work. That's witchcraft. That's crazy, right? We don't do these things. It really silenced a lot of ancestral wisdom and this understanding that we kind of know what we need to heal, although sometimes it has to include going and seeking out westernized care and maybe implementing, medicines or therapies. We want to honor that people have a lot of these tools already and that there's a lot of value and worth in them, and a lot of them cannot be nicely wrapped up into a clinical study, but it doesn't mean it doesn't work. Just because we can't make something replicate on a evidence-based practice kind of level doesn't mean it's not working for someone. The other reason it's important is, for example, neurodivergent clients, they often can struggle with cognitive and talk-based approaches, labeling emotions in particular. So a lot of my clients on the autism spectrum or with ADHD, for example, will bring out an emotions wheel and they're angry, really struggling to say, okay, well, there's 6 other words for the anger that you might be feeling. And sometimes they'll report, well, I felt like I was trying to pass a test. I felt like you just wanted an answer. And so I was yeah, it was rage. And they just felt like they were on the spot, and they're not truly connecting cognitively with the emotions. But when we bring out something like squeezing that pillow or pushing that wall and saying, well, how did you feel when that doctor did dismiss how you're feeling? They're yeah, I felt that feeling that I got when I squeezed that pillow really hard. It's okay, so we felt it in our body, we just don't quite have a word for it. Well, it would make sense that then they're not going to benefit too much from a top-down cognitive therapy approach. They're going to benefit more from, let's rehearse how we're going to talk to that doctor next time, and let's do it while we're hugging that pillow. Let's get back in that physical sense that we know we're going to feel when we go back to that doctor's office, so that we can know how we're going to rehearse our response, but that it's not all going to fly out of our head when we're in this, whatever we want to label that new emotion. One of my clients is I just call it my squeezed up emotion. I'm that's great. We'll put that in the new DSM, right? That's awesome. We'll call it whatever we need to call it, but it's going to help us to connect more with that. Different things like just rhythm and sensory tools, having an accessible therapy room where we can actually do these interventions, that clients feel like they're welcome to sit in a different way or pick up a fidget or move their body. It's something that I think a lot of us are working on doing more of, but many doctors' offices, for example, are a very harsh environment for neurodivergent clients. Hospitals are, birthing spaces are. So how do we work on helping clients to reclaim that sense of safety from a somatic perspective? We know a lot about, I feel like every other training today is going to be on misogyny and medical trauma and dismissiveness of birth. So I just wanted to mention, when we bring back in nature and ancestral healing, we're kind of doing something different than the Western model is doing. I wanted to do some case consultations or just case studies of where I've seen this really work. So in a client, for example, with postpartum rage, what she was noticing is after she went through her birth, she had a really horrific experience. And a lot of clients that come to me, have this more holistic idea about them, but then they're kind of forced into a medicalized system, and then they feel like all of their autonomy was taken away, or they were super traumatized by the medical industry. So she ended up with a lot of anger and rage, and she's I don't get it. I'm so grateful, for my baby, and I really love being a mom, and I've dreamed of this, but everything's making me mad. Like, I used to love my dogs, I hate my dogs. I used to love my husband, I hate my husband. Like, someone knocks on the door and I'm like envisioning how I'm going to like murder them because like my baby just went to sleep and she hasn't slept in like 3 days, right? And she was so angry. And so we talked a lot about when those moments happen, we were using that ladder, that ventral vagal ladder. Like, you are stuck in the most like heightened fight or flight mode, state, but it has a survival mechanism. And she was able to think back in her birth where she had planned this really holistic birth, and then things went wrong and there was this cascade of interventions. And in that one moment where she felt like all her autonomy was stripped away, she felt this like pit of her stomach. Like, you could actually see her in session talking about it and like she just collapsed in, right? So we need to be aware somatically as therapists that really tells us more sometimes than a client is verbalizing. So she at first was like, she would retell that birth trauma like she had written it as a book or read it in a book, right? And I'm like, okay, but when you get to that part, do you notice that shift? Do you notice that you're like protecting yourself in and you're balling up your fists? Like, you're so mad that those doctors pushed you into those interventions, or that they said that thing, or that they insinuated blame, or whatever it was. So we talked a lot about, in that moment, as soon as she cocooned in, if she could take a moment, take a breath, and just open up her chest. So like we did in that first practice, right? So we were talking about you can squeeze everything in together, and then as you inhale, you can open up and work on just like feeling like you can kind of be vulnerable again. So even just that little example, yes, we're taking it from a cat-cow like yoga pose, right? But we're implementing it into mental health, and it is a somatic practice, and we're helping that reconnection. So as she started doing that, she started crying, and it was kind of like all of this release of everything that had been bundled in and kept inside. Was it magical, and did she stop hating her dogs and her husband like the next day? No, right? Like, it's like this, we still have to do the work. But what we started noticing is she could then see where she was on that continuum. And we did a lot of education on like where the role of adrenaline and the fight or flight mode comes in. When you're in a hospital and you're giving birth and you feel unsafe, doctors and nurses running at you and saying, well, how dare you even try to home birth? Like, don't you know this is what always happens? It feels like a physical attack, right? And we are the only animals in the animal kingdom that don't lash back out or run away when we're attacked. I don't know if you've ever read Why Zebras Don't Get Ulcers. It's like a super old book. I'm like dating myself, but it talks about, how we're the only animals in the animal kingdom that someone's yelling right in our face or coercing us into something or yelling at us, and we just kind of freeze because we think, oh, well, I'm supposed to listen to the doctors and they're saying this is the only way to save my life, or I have no choice. So then that adrenaline is building up and we can't use it for something. So it comes out as rage later, it converts to cortisol, the stress hormone, like all of these things happen. So she started to recognize there was such a real science behind how she was feeling. She wasn't a bad person. She wasn't crazy, but then she was feeling in her body how we could get out of that state. So she already had a yoga practice, so for her, I don't usually say, go home and do a bunch of yoga in your yoga corner, because that's not really tangible for people. She already had a great yoga practice, so she was like, oh, that's not just something that feels good to do a workout anymore, it's actually bringing me into a different nervous system state. And then we did a lot of visualizations. Like when she was holding her baby, she was having a lot of flashbacks of the birth trauma. So we focused instead on when you're holding your baby and doing your breath work, think about that place that you love to be together, which was walking, on the street near their house, and noticing the nervous system shift that occurs just from a visualization. So our brains don't always know the difference between what we're visualizing intensively enough and an actual experience. So they did this study where there was phantom limb pain. And so they made a box, so someone that only had one hand and then had a phantom limb pain in a hand that had been amputated, they set up a series of mirrors. So when they looked down, doing physical therapy exercises with the existing hand, it looked as if they were also doing it with the phantom hand. And what they found is after enough repeated movement where they were visualizing that phantom limb was doing the PT exercises, the phantom pain was going away. So that power of visualizing is so important. And I don't think it's a huge leap to take that study and replicate it with, I'm having this traumatic flashback of how my birth went. I'm just going to sit here and visualize the day we came home and focus on the good memory, the first time we sat in the rocking chair that we had set up in the corner that I had prepared with so much love, and to continually put yourself back into a visualization of a state that did make you feel good. So that's something that we focused on, in addition to processing the trauma and working through that. When the trauma became more of an intrusive, uncontrolled memory that brought up the rage, I wanted to articulate that. That's when we would focus on the visualization. We weren't just dismissing the trauma and saying never think about the trauma, but we can work on then creating how do we come back to safety after that. I won't go through every single client, but especially clients with severe anxiety, a lot of them need movement before stillness. So something I notice sometimes when we're working on somatics and mindfulness and breath work, there's this huge focus on being just like instantly, we're going to do breath work and we're going to meditate. Some people really feel uncomfortable with stillness and they have a lot of energy to get out. So I've done sessions with clients where we'd meet up on the bike path with like the stroller and we'll do walk and talk sessions, getting some of that pent up energy out with someone with high anxiety. If their symptom is a lot of rage or a lot of like racing thoughts, the more intense movement is probably going to serve them better. If you take a client with crazy intrusive thoughts and rage and they feel like they can't control it, and you're like, we're just going to sit here and we're going to do this new skill I used, and it's called sitting here with your thoughts and practicing self-compassion, they're going to never come back, right? They're going to freak out. So we have to kind of figure out, by using that nervous system literacy with them, like, where is your nervous system? And what do you actually need to feel better today? It might not be what we think they need. They might be like, I just want to walk all of this energy out and just like sweat and breathe really heavy, and I need to get this out. Okay, cool. How do we get you that during your day so that we can come into a moment of mindfulness as well? So we're building integrative care plans. We're helping the clients to feel like they are in control of their treatment. And we are going to get into a different little practice here in a little bit, so don't worry, have faith. We're going to do some more mindfulness too. But I have a couple more things to say. They are like they're going nuts over there. So I wanted to also mention, kind of going back to the yoga therapy in particular, and only because it's kind of the specialty that I focus on the most, but some of the different tools that we can use. So one of the examples would be a metta meditation. I know we want to bring some tools back home to our clients. So we're going to practice this together, and if you want to take notes on just some of the ideas that we can use, that's fine. So we're going to again come into just a comfortable position, and we're going to find our breath and kind of allow our body to soften. Sorry, see, we're doing a lot of like back and forth. You're like, I'm in learning mode, and now I have to breathe. So we're going to just find a moment here, bring our attention back to our breath, and kind of allow our body to soften. And we're going to repeat silently to ourselves, may I be safe, may I be healthy, may I live with ease, and may I feel loved. May I be safe, may I be healthy, may I live with ease, and may I feel loved. We're going to work on expanding it outward. So we're going to picture a loved one. And this might be, in a clinical example, the child or this partner or whoever. And we're going to think, may they feel safe. May they feel healthy. May they live with ease. And may they always feel loved. They were very excited about that one. We can also push that out to a neutral person, someone that we don't really have any strong feelings for, but we want to work on expanding our compassion. So maybe a boss or maybe an acquaintance that we just met, thinking about them feeling safe, and may they be healthy and live with ease and feel loved. The next step is usually someone we struggle with. So I find in birth trauma or in perinatal, disorders in general, focusing on medical providers that we struggle with, or partners that might not be waking up when the baby's crying, for example. We can focus on them next. Visualizing them, really seeing them. May they feel safe. May they feel healthy. May they live with ease, and may they feel loved. And the next step is pushing that out to all beings in the world. May all beings be safe. May all beings be healthy. May all beings live with ease. And may all beings feel love. And so this is something that I think is really accessible to most clients. We can add in placing that hand on the heart or the belly. We can add on, I like sometimes like placing our hand on our neck if we're trying to open up, through our jaw and kind of just thinking about, as we're saying those words, did it feel difficult? Often we'll clench our jaw, especially when we're like, oh, may that doctor feel a sense of ease and be healthy all the time, because that's the one that traumatized us. So then taking that moment to kind of remind ourselves, like, did any trauma manifest in my body somewhere somatically when I'm trying to do these difficult things, and then allowing a release of that. So there have been studies on this. Studies show that meta-activity, it activates areas of the brain associated with empathy and emotional regulation, but also at the same time it reduces the amygdala activity linked to fear and anger. So it's just one of those nice ones that's an easier one to introduce to people. When we also think about bringing in some yoga philosophy, again, I like that this is something where it can offer a way of integrating some ideals that are not clinical, but we don't have to always take the yoga framework. One of those ideals is ahimsa, or non-harm. And so the way I like to frame this is we're practicing non-violence is usually how ahimsa is viewed. But practicing non-violence toward ourselves is sometimes something that we overlook. So a lot of clients are engaged in constant self-judgment. I should be better by now. I'm not bonding with my baby like I should. I'm such a bad mom. All of these kind of self-depreciating thoughts. So the invitation can become, how do we soften that inner critic today? How do we practice kindness to ourselves? If you were talking to your baby, would you say those same things if they were going through something like that, right? All of these invitations that we have often in the therapy room, they can come back to this idea of nonviolence. The practice of self-inquiry. A lot of times the postpartum period brings about this sense of identity crisis. So they might say, like, I don't even know who I am anymore. Like, I became a mom and everything just changed. I have no idea who I am. So that is like very disorienting to the limbic system going through these transitions. So we have to address this in ways that are gentle and non-pathologizing. Maybe guided journaling after that meditation. What parts of me are being reborn in this new path of life? What are my values as I become this new version of myself? We also think about letting go of things, not grasping onto old ways of our identity. So grieving the birth that they didn't have, or that bond that they expected, or how they imagined things working out. We want to help them to normalize that it's okay that things didn't go the way that they wanted, and a lot of times the trauma is caught up in, how did I picture that was going to go? How many of us have worked with clients who had like a 15-page birth plan, and it was like, I love birth plans. I think it's great that you want to have a sense of agency and autonomy, but we all know how often things deviate and go wrong, and so much of that anger or grief is caught up in what I believed things were going to look like, and then how they worked out. So helping to let go of some of those feelings as well, or to just be at peace with them. Like, I had planned this amazing thing, and I'm sure all that research I did is going to always help me be a good parent, but it's okay that it didn't go well in that moment. Like, trying to think of different ways of framing it as well. So does anyone have any questions now before we do another small practice? I just want to make sure I'm addressing any questions that might have come up. Okay. So we're going to take another moment, and we're going to focus on kind of closing our eyes here just to reconnect with our breath again. Because again, we're sitting there, we're taking notes, we might be tensing up. So. Oh, I'm so sorry. You way over in the corner.
Yeah, for the kind of standing mantra.
Yeah.
I see a lot of patients with mental health providers.
Can you hold on for
Oh, perfect. The microphone.
I'm a mental health provider, and I work in the OBGYN midwifery clinic. And I would say the majority of perinatal patients in cis-het relationships have a really hard time with their male identified partners.
Yeah. Right. No, I love that. The question is basically with the meta meditation, right? For example, if we're not always having to say that the person that we're directing that to is any particular person. If they are identifying, I feel like this rage towards my partner is not really founded, or, I am upset about that, but I don't want to feel such a deep sense of rage, then I would say we should use that meta meditation for that. However, I have definitely worked with clients where the rage is justified and the other parent is maybe not stepping in the way they should, or we have to call a spade a spade. Like if someone is being abusive or is not being helpful, we don't want to be like, yeah, meta meditation is going to take care of that, right? So we can pick someone else that they can put in that visualization, and the partner can be, bookmarked for a different session where we're working on, assertiveness and setting boundaries and maybe some couples counseling. So it's a really good question though. Like I think, again, there's certain doctors that don't really, this isn't going to sound very meta of me, there's certain doctors that, we might have a harder time, for example, being like, yeah, let's direct this to someone that really hurt me. A lot of it more so is for that sense of forgiveness in yourself. If it feels like I would feel better if I didn't carry this sense of reactivity, if I can picture them, that I'm sending them some positive energy, it might feel healing. But yeah, we don't want to, like you said, we don't want to feel like it has to be, oh, just picture your partner in this situation, because sometimes they don't really deserve to feel healthy right now. They deserve to feel a little uncomfortable and be getting up at night, right? So thank you for asking that. And I think, again, it's like that idea of pacing and permission-centered care is, I'm so glad you brought that up because it's a whole other area there. This approach is going to be really starkly different from the Western model, right? So a lot of birth trauma is not from the physical outcome, it's from lack of control. It's from people telling them what you have to do. It's from this violations of consent. So we don't want to be putting out these interventions and saying, oh yeah, this intervention is only going to help with like being okay with your partner. It's like, whoever you want to think about, let's work on that part of it for sure. Okay, so now, you got a question?
I do. My question is about things like meeting people for walks, and I think that's like fantastic.
Yeah.
Something that I want to do.
Yeah.
Is there a special way to document it, or is there a special liability that you have to?
Right. Yep. So the question was for like the walk and talk sessions. Is there any kind of liability or forms for that? So back during COVID, there was a form that went around that was like a walk and talk permission form, and I still have that. I could always email it to anyone. If anyone wants, I can email what I have. I'm sure ChatGPT could make a better one, or someone else might have one. But what I always tell clients is like, someone might see us out and they might know I'm a therapist and assume I'm your therapist, or if you're on a busy trail, someone might overhear some sensitive topics. So we're usually a little more careful with just like, hey, it might feel good to come out and walk and talk about these things. Maybe we can go find a bench over there if you want to get into some like trauma disclosure, but just with that understanding, like it really is not as safe or protected as the treatment room. During COVID, I did like 1 million outdoor sessions, so it became a norm. And I used to do home-based therapy, so it feels safe for me. Like really use your discretion. Obviously we know, just like be careful meeting clients in random places. But I'm used to that because it was like, hey, today you have to go to this house over here and just show up, and it is what it is. So we all have different levels of comfort with that for sure. But yeah, thank you for asking that. It can feel safe too, again, to normalize experience. You don't have to come to a therapy room. You can be somewhere that's just neutral as well. So perfect. Awesome. Any other questions? I don't want to roll over anyone else.
Do you have some recommendations to use these techniques online? Because I'm not sure
Yeah.
that is different.
For sure. So for telehealth in particular, so most of my clients are telehealth. I actually find that telehealth is really helpful with the postpartum population because they can have their babies with them. They have access to safe spaces. I used to have them bring their babies into the office a lot. Most of my clinical practice is in Rhode Island, so during COVID we like shut down. And so a lot of it switched to telehealth, but I do find with new parents, it's such a task just getting out of the house. And, so many parents, like that's their biggest barrier to care, especially if they have multiple kids, is like, I can't get childcare. the scariest part of my day with these intrusive thoughts is putting this baby in a car and going somewhere. So with the telehealth, usually, like I said, we don't do any big movements too much, but sometimes it can be more accessible to them, where I'll be like, while we're talking, why don't you go and like walk up and down the stairs a few times and like dispel some of this nervous energy that you're identifying? Why don't you go over and like just push that wall or like punch the couch, or like, if you're feeling that sense in your body rising up, they might have access to more things that they could feel a little less embarrassed about doing at home that they might not want to do in a therapy space. So I do think it can all be used in that way too, for sure. Thank you for asking that. So I want us to have time to do a second little bit of a mindfulness practice as well. So I have like 50 pages of the literature and research where I'm like, I could talk about all of these things, but we came to have some experiences too for this long conference. So again, we're just gonna find a space and settle in. We're gonna sit with our feet flat on the floor, or if we're on the ground, whatever feels comfortable. And we're just gonna notice again. We're gonna do a gentle body scan. We're gonna notice that sensation of our feet as they're rooting us connected and safe to the earth. We're going to notice that sensation of our hips grounding us on the chair. And maybe we'll rock back and forth very gently side to side. Just noticing that sensation from one hip to the other. Kind of grounding ourselves in our chair. And just taking a moment of stillness. And let's practice lifting one foot at a time off the ground, very gently, only about an inch off the ground. And then marching the other foot up off the ground. Very gentle marching here. Just activating through our hip flexors to lift that leg just a few inches. And we can visualize even that we're walking somewhere that's relaxing to us here. And then we'll bring some stillness to our feet. Let's place a hand on our belly. Just check where our breath is today. Are we feeling our breath more centered toward our chest or toward our belly? Where do we feel that our breath naturally gravitates towards? And let's try, just for this moment, even if it doesn't feel natural, really breathing into our belly. And then lifting through our chest. And then on the exhale, drawing our belly button back towards our spine. Inhale, pushing out through our belly into our hand. And exhale, belly button back towards spine. Noticing a sense that we are free to take up space. We are free to feel and experience our body where it is. Taking that breath here, you're welcome to try whatever feels good here in this moment. So we might want to add in some arm movements. We might want to practice inhaling, reaching our arms up overhead, and exhaling, bringing our arms back down to our lap, letting them fall with a thud onto our lap. And we can try that a few times if it feels good. Inhale, reaching tall. And exhaling, letting those arms fall with a thud. Oh, that might have been loud, sorry. As I slap the microphone away. Inhale, reaching tall. And exhale with a sigh and a thud. Do that a few more times. Hopefully we all put on deodorant today. Inhale. And exhale with a thud. So we can do that as many times as it feels good, but we always want to offer those options and honor that right to take a pause or do whatever feels good to our body. Sorry, I am fine with anyone who doesn't wear deodorant too. We are all humans. We all smell the same. It is all good. And so while we're here, we just focused on that breath. We just focused on reconnecting to ourselves. I want us to take a moment and think about maybe something we've gone through. It doesn't have to be anything super traumatic, but I want us to take a moment and kind of put ourselves in our client's shoes. Think about something we're struggling with. It doesn't have to be anything, groundbreaking, but we want to think about a time where maybe we felt that we weren't heard or we weren't respected. And really notice, where do we feel that in our body? Now that we're at a baseline, we've kind of calmed our nervous system down. Where do we intuitively or instinctively feel that sense of that difficult emotion coming up? right? Is it something that it feels clenched in our throat? Is it something where it feels tight in our heart? Do we feel it in our hips? Bringing awareness to that, noticing the quality of that feeling. Noticing, does it feel like it's heavy, it's sudden? Does it feel like it's something that's been stuck there for a while, or does it come and go? And then instinctively, we might work on, is there any part of our body that needs our attention right now? So again, inviting clients to kind of come up with their own interventions. Somatics does not have to be something that we tell them everything to do. So maybe if it's in our throat, we focus on massaging through our throat or our jaw. If it's in our heart, we focus on putting our hands on the chair behind us and just opening up, looking to the sky, expanding through our heart center. If it's in our hips, maybe we put one ankle on opposite knee and kind of lean forward, and then do the same with the other side. We can be integrating some of these movements even in a chair, even in a therapy setting. So when we're ready, I know some of us are still doing that exercise and we're noticing where it feels good. We can come back and we can either close our eyes or just soften our gaze. And notice if that release that we just gave ourselves shifted the experience or shifted that feeling. Do we notice a different quality to the sensation? How is our body doing now? We're focusing on kind of trusting the process, noticing that as we move our body and release these things, we're going to start to feel a little bit differently, and it might open up some different ideas of how we experience things. And I wanted to close out by just reframing suffering a little bit and how the holistic perspective comes in. I know we've touched on this a little bit, but really reminding ourselves suffering is not a pathology to fix. Suffering is something we all experience. And I know a lot of times we kind of pathologize it a little too much. So suffering can actually be this opportunity to grow and to find wisdom or connection. In Western medicine, a lot of times, like through the DSM lens, it's seen as something that is a disorder that needs to be managed. A parent's grief or survivor's rage or panic becomes something that is pathologized. When we can include things like mindfulness, Viktor Frankl's logotherapy, finding meaning, or acceptance and commitment therapy, and blend these with somatics, we take ourselves out of that pathologized language. In yoga, there's this concept of tapas, which is spiritual discipline through discomfort. In Buddhism, they call it dukkha, this inherent suffering of existence. And then with Viktor Frankl, he talks on meaning-making through trauma, through unspeakable trauma. So if we reflect back on all of this, it allows us to create a framework where we just sit with our clients and hold their hand through this normal experience that we're all going to go through. For right now, we're focusing on birth trauma. Everyone is going to have some sort of trauma in their lives, and it's the same lens, right? We focus on a lot of the things that have to be specific for birth, but we're trying to normalize that experience is something that we are going to all have to walk through at some point, and that these skills and finding that wisdom within ourselves is something that we should allow clients to help find that autonomy to process. Thank you guys for being able to come today. I wanted to open up if anyone had questions, but I also honor if anyone needs to take their own movement break and get a drink before the next thing. I had more than I needed. I just wanted to make sure I was giving people time to ask questions and everything too. Thank you. Hi.
You're in Rhode Island. I'm in Connecticut.
Oh, that's amazing. So my practice is based out of Warwick, but so I live half the year in Florida and half the year in Rhode Island, and so we manage a practice in Rhode Island because Florida's crazy to try to practice mental health.
Okay. So I work in Putnam, Connecticut.
Oh, wonderful. Okay, yeah.
I'm trying to transition to a private practice.
Yes.
The medical model is
It's so
really
broken.